upper part in the front of the neck, in the midline, for last 6 months. But she does not complain of any symptoms suggestive of thyrotoxicosis. There is no tremors and there are no eye signs. Any swelling in the front of the neck, especially in the midline. This particular swelling appears to be in the midline. Hence, there are 3 or 4 important differential diagnoses in such cases. First is you have to see whether this swelling is arising from the skin or it is arising from the deep part of the skin or it is from the lymph nodes or it is from the trachea itself. So these are the 4 important structures in this area, mainly the skin, subcutaneous tissue, thyroid gland, and which part of the thyroid gland is thymus. And then posterior to that is the trachea. So this patient does not have any symptoms related to thyrotoxicosis. हाथ आगे करिएगा. There are no tremors and she is not having tachycardia and there are no eye signs. So this from the clinical point of view, there is no eye signs, no tremors and no tachycardia. Now we like to find out on examination what is this particular swelling. So first thing we will see for local temperature. Local temperature is normal. Then tenderness. When we are pressing, it is non-tender. Then when we are pinching the skin is pinched. That means skin is separate from the swelling. And there is no punctum over this swelling. That is very important because that has to be differentiated from a cutaneous sebaceous cyst. So there is no punctum. Skin can be pinched separately at different points. And now we will ask her to deglutate. Thuk satakiye. There is no definite movement but slight movement of the skin. So in a thyroid swelling, then normally the swelling moves up on deglutation. In a thyroglossal cyst, what happens is that since the cyst is attached to the base of the tongue, so posterior aspect of the base of the tongue, so what we do, we ask the patient to open the mouth. Muh kholiye and then ask her to protrude the tongue, zuban bahar nikaliye. There is no movement in this swelling. So if there, andar kar liye jeeb andar kar. Now again, this test is very important because this will tell us whether the swelling is a thyroglossal cyst or a thyroid gland. If it is a thyroglossal cyst, the swelling will come upwards when the patient protrudes out the tongue. So in this, it is very important to keep the patient's mouth open. So in this case, we have kept the patient's mouth open and we ask her to jeeb bahar nikaliye. There is no movement in this swelling. Andar kar lijiye jeeb, muh band kar lijiye. Now what we will do, we will try to confirm it by putting our finger over the swelling. And then again ask her to muh kholiye, jeeb bahar nikaliye. There is no tension on my finger. So that is another way of testing whether this swelling is moving with deglutation, with the protrusion of the tongue. A thyroid swelling and even a thyroglossal cyst will move with deglutation. But the protrusion of the tongue is exclusive to a thyroglossal cyst. So in this case, it is not moving with protrusion of the tongue, neither it is moving with deglutation. Then the third thing is trachea. Of course, for that we have to check this finger. We do the 3-finger test. We put these 2 fingers and in the center we try to feel the trachea. The trachea is central, so there is no deviation of the trachea. So it is again not arising from the trachea. Now, so coming to the conclusion, it is not a thyroglossal cyst. It is not a thyroid swelling. It is not a swelling arising from the skin, which is a sebaceous cyst, and neither it is a lymph node. So for that lymph node, we'll also have to examine other groups. We starting submental, submandibular, preauricular, postauricular, occipitary, jugulo-digastric, jugulo-omohyoid, and supraclavicular, and the spinal accessory group. This has to be done on both sides. Again, submental, submandibular, preauricular, postauricular, and then jugulo-digastric, jugulo-omohyoid, and supraclavicular. And this is the central group, which is now what it is. Now, just slight movement, it is slipping under the examining finger, and it is firm in consistency, slightly softer. So this appears to be a simple case of lipoma. So by the process exclusion, it is not a thyroglossal cyst, it is not a thyroid swelling, it is not arising from the trachea, it's not a lymph node, and it's not a sebaceous cyst. So the only final diagnosis on clinical examination is a lipoma. And this is a very simple procedure. We can operate it in the OPD or it can be operated in the main field. Thank you very much. The diagnosis is almost clinically, it is a case of lipoma. So nothing to worry about, but we just have basic investigations for this case to rule out the thyroid profile, and we take an X-ray of the neck to see the trachea. Otherwise, it's simple lipoma. Thank you very much.